Good morning. Today we'll discuss about space maintenance. The primary teeth are imperative in a child's growth and development. They are vital for mastication and speech, but they also have an important role in the guidance and eruption of permanent teeth by acting as a natural space maintainer. So coming into terminologies, the space management can be defined as methods of procedure which is brought into use following the premature loss of primary tooth to prevent loss of space and also to improve the arch development. It includes a space maintenance, space regaining, space supervision, and seeded extraction. Space maintenance is defined as the process of maintaining space in a given arch previously occupied by a teeth or a group of teeth. It was given by J.C. Brower in 1941. So the objectives are preservation of the integrity of dental arches, preservation of primate spaces, preservation of normal occlusal plane, and aids in aesthetics and phonetics. So the factors to be considered for space maintenance are incidence of space loss, time elapsing since loss, dental age of the patient, amount of space closure, direction of closure, eruption timing of permanent successor, amount of bone covering the unerupted tooth, abnormal oral musculature, and congenital absence of permanent tooth. So moving on to classification, according to Hitchcock, it can be space maintenance classified as removable, fixed or semi-fixed, with bands or without bands, functional or non-functional, active or passive, and certain combinations of the above. According to Hinrichsen in 1962, it is classified into fixed and removable. Under fixed, there is class 1 and class 2. In class 1, there is functional and non-functional. Whereas in class 2, it is distal shoe and band and loop. And removable are acrylic partial dentures. According to Raymond C. Thoreau, it is classified as removable, complete arch, lingual arch, extraoral anchorage, and individual tooth. So, moving on to fixed space maintainers. The advantages are they can be given in uncooperative patients where the removable appliance may fail due to loss, breakage, or failure to wear the appliance. It does not interfere with passive eruption of abutment tooth. The jaw growth is not hampered. The succedaneous permanent teeth are guided well, minimal discomfort, and reduced need for patient cooperation. Disadvantages are elaborate instrumentation with expert skill is needed. Decalcification of tooth may occur under the bands. Torque forces on abutment teeth can result in appliance breakage, supra-eruption of opposing tooth if bondings are not used. So various fixed space maintenance are band and loop, band and bar, crown and loop, lingual arch, transpalatal arch, transpalatal arch, distal shoe, fixed appliance for anterior space maintenance, bonded space maintenance. So the fabrication of fixed space maintenance, there is band construction, taking the impression and cast preparation, loop fabrication, soldering, polishing, and cementation. Armamentarium used are band material that can be preformed bands or SS crowns can be used, band seaters and wire cutters, soldering materials, stainless steel orthodontic wires, band contouring pliers, port welding unit, finishing burrs, and polishing stones. These are the various armamentarium used for band and loop space maintenance as well as the fixed space maintenance. So these are the steps in molar band preparation. First, there is initial spot welding, then buckle groove adaptation, rounding of the margins using a burr, pinching with four player, and then final pinching and seating of the band. Next is band pushing. Next, you can see the completely adapted band around the tooth. And the last step is finishing and polishing. So the impression taking and band stabilization. Make sure that the contract impression tray extended 5 to 6 mm beyond the distal abutment tooth, and band stabilization can be done using direct method or indirect method. Direct method is orthodontic wires, sticky wax, and L-shaped orthodontic wires. Stapler method, bobby pin method, super glue technique, and green stick compound can be used for stabilizing the band. So moving on to band and loop space maintainer, it is a cantilever type of fixed space maintainer that consists of a band cemented commonly onto the posterior tooth of the dentulous space and a loop of wire across the dentulous space abutting the anterior tooth. 0.036-inch wire loop is used in the construction of band and loop space maintainer. Indications are premature loss of any primary first molar in the primary dentition of the primary maxillary first molar in the transitional dentition. Premature loss of primary second molar as the permanent first molar is erupting clinically. Contraindications are An occlusion that is extremely crowded, high dental caries activity, replacement of primary anterior teeth, replacement of primary second molars in primary dentition without partial clinical eruption of the first permanent molar. Design of the loop. The arms of the loop should be placed at the junction of the middle and cervical third at the same time, not interfering with occlusion. And the contour of the loop should be similar as close as possible to gingival contour. And the final width of the loop should be wide enough to allow eruption of the premolar inside the loop. And the loop should be placed just above the contact area of the supporting tooth in a passive manner so as not to slip down. So the modifications are, according to Robert Rapp and Isid Demiros, stoppers can be used to prevent gingival as well as buccal movement of the loop. Crown and loop, same as band and loop, but a stainless steel crown is used as an abutment tooth instead of a band. Next is crown, band and loop. Stainless steel crown is done first, and on that banding is done. Next is reverse band and loop. This type of fixed space maintainer is specifically given when the second primary molar has been lost and the distal aspect of the first permanent molar is not erupted fully. So there is a large pericoronal flap. The band is placed on the first primary molar. Next is band and bar. Prevents the eruption of premolar. It is used in unilateral loss of primary molars. Here, both teeth on either side of the space may be banded and the bar may be soldered between them. Next is long band and loop when both the primary molars are lost. Next is band and loop space maintained with occlusal rest. A small occlusal rest is designed on the loop wire. This is placed to prevent the mandibular right firstman molar from tipping and causing the wire to imbibe apically in the tissues distal to the first primary molar. Thus, the occlusal rest helps prevent the tipping motion of the first permanent molar. That is band and loop space maintainer with occlusal rest. Next is Maney space maintainer, which was designed by W.R. Maney. Type of non-functional space maintainer. Cantilever arm initially engages the abutment tooth. Minor adjustment may be made on the erupting premolar, moving it lingually or distally.